Commonly called quicksilver, mercury was once a trusted symbol of precision in healthcare. But behind that silver sheen lay a silent danger. The poison, once released, could travel through air, water and soil, harming life in ways we could barely imagine. The world learned this the hard way. In a small Japanese town of Minamata, a tragedy unfolded. Mercury from industrial waste entered the sea, poisoning fish and the people who ate them. Minamata became a haunting reminder that what heals us should never harm us. In 2013, nations came together under the Minamata Convention on Mercury, a global commitment to protect human health and the environment. India ratified the treaty in 2018, pledging to phase out mercury-based products, including those used in healthcare. But long before the global promise was made, the journey towards mercury-free healthcare had already begun in National Capital Territory of Delhi. Toxics Link began a quiet but determined movement, meeting doctors, nurses and hospital administrators, telling them the story of Minamata, where mercury poisoning destroyed lives and futures. Slowly, awareness began to spread. Some of Delhi's leading hospitals decided it was time to act. They took a bold step. They would go mercury-free. Conversations intensified between hospitals and the Delhi government.
That is how we started off. I still remember there was a lady in Toxic Link who gave a lecture to the nurses. He gave lectures on mercury poisoning, and Minamata, she gave those examples, and the nurses, got frightened.
In 2007, Delhi took a bold policy step, notifying the gradual phase-out of all mercury-based medical equipment from all hospitals. It was a story of environmental stewardship, policy action and change. In 2010, the Union Ministry of Health and Family Welfare asked all central government hospitals and health centers to gradually phase out mercury equipment and replace those with good quality non-mercury equipment. In 2012, the Central Pollution Control Board (CPCB) also issued guidelines supporting the transition and proposing environmentally sound management of mercury waste. Availability of non-mercury instruments was limited back then. There were few options and many, including nurses and patients, doubted their accuracy. But hospital managements too showed tremendous willpower. They developed internal policies to support the shift. Procurement of mercury instruments was stopped. Intense market surveys were done to identify reliable instruments. The hospital staff underwent rigorous training. Government leadership and hospital managements, both in private and public hospitals, came together with the goal to protect patients, staff and the environment. Nurses who once resisted the change soon became its strongest advocates. They learned, adapted and eventually mastered the use of non-mercury thermometers and phygmomanometers.
Around mid-2005, we can say, changed the mercury thermometer to the digital one. Still, we could not complete it in all the areas. So, gradually we started from the small wards to the bigger ward and the OPD areas also.
From the fear of mercury spells to having mercury-free hospitals, this was Delhi's journey of transformation. It grew into a national movement. Several states, UTs and districts joined the movement. Starting from Punjab and Manipur, it spread to Goa, Bihar, West Bengal, Chandigarh, Andaman and Nicobar Islands, Kerala, Sikkim, Telangana, Meghalaya, Karnataka, Tamil Nadu, Andhra, Chhattisgarh, Ladakh, and the list is growing. In most states, procurement of mercury-based instruments in government establishments has been discontinued. The change is happening. Doctors and administrators have realized that mercury-free care is not just possible, it's practical. Hospitals have adapted and are helped by better market availability of non-mercury instruments. The healthcare equipment market has also responded, bringing in more choices, better technology, and safer alternatives. Calibration is ensuring that the equipment's accuracy is maintained.
There are so many problems with mercury. Number one is, environmental pollution by mercury because of use of mercury instrument. That was number one. Number two, it has a glass tube which used to break, air used to leak inside, and we used to get faulty results. Sometimes the mercury would come out of the tube. All those things are not here if this is calibrated properly.
But the journey of transformation is not the same everywhere. From limited awareness to lingering perceptions about mercury being more accurate, the challenges remain.
I think the process has long been initiated, and we should be able to hasten the complete transition of mercury instruments to mercury-free alternatives in our country.
Every replaced thermometer, every digital BP monitor, every awareness session is a step towards a healthier, more sustainable future. True healing doesn't just cure people, it protects the world they live in.